Let's talk about Botox. Now, when I say Botox, I mean neurotoxins. Botox was first to the market, and believe it or not, first to the market in the 80s. It was used medically. And then serendipitously, it was found to calm the muscles and hence calm the wrinkles on one side where it was being injected medically. And this was up on the side of the face and the eye muscle. And then sprung from there, we had some great smart dermatologists here in Canada, by the way, who then put it to task with the other muscle causing line expressions of the upper face. So up here, mainly the 11s and the forehead muscles, and then the crow's feet. Botox Cosmetic just had a 30-year anniversary, and Botox, the medical use, a 40-year anniversary. By design, it is probably one of the best drugs out there. It's specific, you put it exactly where you want, it doesn't go anywhere else, and it has a decently long range of activity, months, but it's not permanent. So you can customize it, you can put it where you want, you don't have to do the same thing every time. It's almost like it's the perfect drug. And even better, we can use it for a combination of both aesthetic and medical treatments. One of the most common medical treatments would be focal hyperhidrosis, or basically sweaty pits, and it works really, really well. Diving deep into Botox, I wanted to do this video because I heard this week, after 20 years of practice and 5 years of residency, one of my patients say Botox was going into the brain. And so my very nice patient had a friend who, maybe this friend was a little bit more of that conspiracy theory type personality, and heard it, read about it on the internet, and didn't recommend it for her friends, and asked her friends who were doing Botox to please stop. And so after 40 years of clinical practice, used in infants with contractual muscle pain to relieve that pain, for adults with spastic sphincters where they are helping with elimination, and migraine protocols where it's aiding in the relief of muscle tension so that incapacitating migraines are now allowing patients to be functional in their work lives and in their social lives. We know that Botox is safe. Now, why are people using Botox for aesthetics? And why is it going in different directions, like now lower face, upper face? Because it just works. It works for relieving that tension. And we know it works on the large muscles to pinch the skin in a large expression line to relieve that. The 11s, of course, the deep forehead lines. Maybe you're a patient who has a shorter forehead and the one deep forehead line. It's very unfortunate. Once that line gets incredibly deep with thick skin, it's very, very difficult to improve and reverse. Maybe you're a patient with a higher forehead and thinner skin. And so the lines on your forehead, I think the highest I've ever counted was 12 lines going up. I mean, there's different ways to customize the Botox. And again, when I say Botox, I truly mean neurotoxin, because there's approximately 5 good quality players on the market in North America, at least. There's many more around the world and more to come. It's not going away. The customizability in terms of the dose, if you have a good qualified injector, they know concentration, dose, placement. They're placing the least amount possible to get the right outcome for the patient. Some of my patients want a little movement. Some of my patients want completely frozen. I've heard, make me into a marble statue. I've heard, pull my eyebrows up like Jack Nicholson. I've heard, don't touch my brow position because I love them exactly the way they are. I've heard, Can you tweak this eyebrow? Because this is the one I really love and I want this one to behave like this one. Asymmetry, facial asymmetry after Bell's palsy or a neurological condition can allow a smile symmetry by manipulating some of the muscles around the mouth so that the smile is a little bit more symmetrical and pleasant to people. And it's a boost of confidence. Let's not forget that really what we are doing with our Botox is allowing a base level of confidence in who we are to present our best selves to the public, to our friends, to our family. Another aspect of Botox, if you're not a Botox user, and again, I will say neurotoxin, but neurotoxin just doesn't have that same flavor. A lot of my patients came in the door for line improvement. They want the lines to go away. They are looking a little older than they feel, but really after a few sessions and then having the Botox kind of wear away and gradually dissipate over say 3, 4, 5 months, they feel this tension closing in on their face, in their foreheads. And it's the tension that they actually don't like more so than the lines in the first place. And so it's that relaxation of the muscles of the face that is the driving factor for certain people. So if you've never tried Botox, know that after 40 years, it's safe, it's precise, the dose, the placement, the groupings of those muscles that we can group together and incorporate or leave them out based on reassessment and reevaluation on each visit. Botox really is, frankly, for everybody. Now, yes, there's a lot of sub 25-year-olds who probably don't need their Botox. I've seen 28-year-olds with so much sun damage on the forehead that those lines are actually looking like they're 40. Okay, yes, I do have some 26 and 28 and 29-year-olds in the clinic, and I think it is truly appropriate. But I do think that Botox is good for everybody. So if you haven't tried it, there's a certain amount of tension in the face that really can be relieved and feel good. It's like those two thumbs that dig into the trapezius muscle after a long day at work, and you just get that feeling. Dare I do say an feeling with Botox? Yes, it does. So it does not go to your brain. It does not migrate and go to other places and cause a toxin or a poisonous effect. It is very, very useful, and I will re-emphasize, customizable. It should be a customizable treatment with a trained physician, trained injector, trained aesthetic medicine health professional who knows what they're doing and can give the result for you, the individual person. I could talk about Botox for hours, really. And Botox, Xeomin, Nuceiva, Dysport, Latibo, there's a lot of players out there, and as I said, there's more to come. So let us know what you think in the comments below. And we're gonna have lots of more videos on Botox, the use. Yeah, thanks for watching. I'm Dr. Marnie Fisher.